Can take a look at a map on this story. This map was done by the Global Health, it's called the Global Health Security Index, and it assesses health security and preparedness for a pandemic across 195 countries. That was put together by two organisations, the Nuclear Threat Initiative and the Johns Hopkins Centre for Health Security. Now, what we can tell from this map is the US and the UK were the two most prepared countries in the world for pandemics. Interesting, to say the least, given that both of those countries have had extremely high rates of infection. And for more on that, we can cross now to North Carolina. And Gavin Yamey, Director of the Centre for Public Impact on Global Health at Duke University. Thank you for talking to us on France 24. Now, you have authored a piece in Time magazine together with Claire Wenham from the London School of Economics, based on the map that we just saw. Now, I think it's fair to say that it's a surprising map in terms of information about the degree of preparedness when you tally it with the high levels of infection. You're in the US. What can you tell us, or what would your impressions be in light of these statistics about, I guess, the Trump administration's handling of the pandemic?
Well, thank you, James, for having me on. I wrote that piece because it's so striking, isn't it? The two countries appear to be the best prepared, on paper at least, from that index, from that scorecard, arguably performed the worst in the world on a variety of metrics, including excess deaths. That's the number of deaths that you see outside of what would be expected under non-crisis conditions. So number one on preparedness was the US. Number two, the UK. The country that has done the worst in the world deaths, the US, and the second worst, the UK. And we wrote this piece because the parallels, which I hope we'll get into, the parallels between the two countries in the level of incompetence in handling are really eerie, very extraordinary. You know, they had downgraded preparedness even before COVID-19 happened, at the wheel when the virus hit. There was a problem. They rejected the WHO's advice. They had an iffy relationship at best. They failed to protect their health workers. And crucially, in both countries, it is people of colour who have been disproportionately killed by the virus. And that's also no coincidence. Structural racism in both countries is the reason for that.
OK, well, looking backward, I guess they are some of the takeaways that we can identify. But going forward, what can be done better now in terms of management of the pandemic, given the high degree of preparedness? So what would you say from the point of view of public policy as we see those numbers going up? Do you think what's being done in California, for example, is absolutely the right thing to do? Shut everything down again? Or
yes,
shut a lot down
absolutely.
again?
I mean, I think I think that when you see a situation, humanitarian catastrophe in many places, you mentioned, your reporter mentioned Florida, Arizona, Texas. Those are humanitarian crisis situations right now. If you look at who is going to be dying, Black Americans, Latinx Americans, Native Americans, this is a humanitarian catastrophe. In that situation, with rising cases, hospitalizations, death rate, ICU full, you really have very little choice other than full lockdown again.
I'll just playing devil's advocate because we have very limited time. Just to put this point to you, with the very limited time we have, advocates of Donald Trump would say you can't keep the country shut down forever, that there are mental health considerations when it comes to prolonged isolation. There is the economy to think of. What would you say to that you have to weigh up different factors?
No, that's simply inaccurate. Those same advocates are the ones that take the precautions necessary. If we are to avoid shutdowns, we need everybody wearing a mask, everybody distancing. We need perfect track and trace systems. The Trump administration won't do any of the above. President Trump refuses to wear a mask. He refuses to fund contact tracing nationwide. We have no plan. We literally have no federal plan in this country for us to get out of this catastrophe. So his supporters cannot have it both ways. Either want a federal plan and protections, face mask, distancing, track and trace, personal protection for health workers, then we can return to some kind of semi-normality until we get a vaccine. But they can't have it both ways. Of course, the best way to boost the economy is to control the virus. That's Viral economics, pandemic economics 101. This is a false dichotomy that we can either have economic growth or stop dying. You know what's really terrible for the economy? People getting sick and dying.
Gavin Yamey, Director of the Centre for Public Impact on Global Health at Duke University, thank you so much for your thoughts on that. Now, next to the situation